Hello, I'm definitely excited to have the opportunity to join the meeting today remotely. I'm a urologist in a busy private practice in Nebraska with a large emphasis on prostate cancer. I'm also the founder and host of the Prostate Health Podcast, which has really helped keep me up on some of the latest technology available for the diagnosis and management of prostate cancer, including episode 104 with Brittany Hunt, where I was able to initially learn more about this technology. I'm excited to now get OnQ Prostate in our community, and we've been up and running now with OnQ Prostate since August of this year. Today, not only will I be able to dive in a bit deeper about the technology, but also be able to share a bit about my real-world experience using OnQ Prostate and helping support clearer interpretation, really helping guide biopsy decisions and strengthen multidisciplinary communication in prostate cancer management. While prostate MRI has been increasingly helpful in improving our ability to detect, localize, and properly stage prostate cancer, there are certainly limitations with our current prostate MRI protocols, including varied accuracy, still failing to detect clinically significant prostate cancer in a substantial number of cases, as well as there being considerable variability in prostate MRI interpretation across radiologists. So I was excited to learn more about a new technology, an FDA-cleared software solution, OnQ Prostate, which is able to help improve the accuracy and reproducibility of today's prostate MRI by improved detection and visualization of clinically significant prostate cancer, enhancing our ability for more precise targeting and ultimately treatment as well. OnQ Prostate utilizes restriction spectrum imaging, or RSI, which is exclusively licensed to Cortex AI from the University of California, San Diego. Restriction spectrum imaging is a novel advanced diffusion sequence designed to improve upon the strengths of conventional MRI while correcting its weaknesses. It involves innovation on both the acquisition and post-processing to better identify the cellular characteristics of aggressive prostate cancer. It does not require a separate pulse sequence or additional scan time. A major advantage of RSI over most other diffusion techniques is that it uses diffusion data collected with multiple gradient directions and b-values, termed multi-shell acquisition. It really is an advanced diffusion MRI technique that helps better separate out the different sources of diffusion signal and really focus on what's coming from true intracellular restrictive diffusion, kind of as a hallmark characteristic for aggressive cancer. So as a urologist looking at these prostate MRIs, what is cool is that it really lights up the lesions, making them very easy to see, which has been a game changer in easily identifying lesions for me in preparation for MRI targeted prostate biopsy, but also when it comes time for treatment planning as well. We are all aware of the limitations that are well documented in the literature with MP-MRI in our current PIRAD system. RSI is not designed to replace our current system, but can be utilized alongside it to optimize it and make it better. There is an increasing demand from urologists for OnQ Prostate as we are having to become increasingly interactive with the imaging. I now preferentially order from the imaging center that offers OnQ Prostate because now I have a tool that can make it easy for me as I map out the MRI ultrasound fusion biopsies, and a technology that has also easily integrated with our current ultrasound MRI fusion transperineal biopsy platform. I also see it becoming a staple to aid in mapping out lesions for targeted focal therapy, but also for the whole gland treatments as well, not only for urologists in planning for a radical prostatectomy and identifying location of the lesion in respect to the capsule and neurovascular bundles, but also for brachytherapy as we work together with the radiation oncologist. The OnQ Prostate technology is really bringing teams together. The urologist, as we are seeing these patients, guiding them along their journey, having the face-to-face conversations regarding the MRI results as they navigate their options for an elevated PSA in terms of confidently moving forward with a biopsy or confidently observing in the case of no suspicious lesions, maybe also a normal prostate biomarker, and avoiding unnecessary biopsies. And also helping with those conversations regarding treatment after a diagnosis has been made. The same goes for the radiation oncologist as well. Then you have the radiologist that's trying to make sure that they are identifying potential cancer. So OnQ Prostate allows all of the stakeholders in prostate cancer care to all work together and actually treat the patient, with RSI being able to be very specific to really aid in making the diagnosis and as well as treatment planning once a diagnosis has been made. Now just running through several case examples. Looking at case 1 here with the standard MRI, with the OnQ Prostate with the restricted signal map and the color fusion map right next to it. Now, the radiologist said that the lesion actually would have been overlooked without OnQ Prostate, looking at the standard MRI. And ultimately on biopsy, grade group 2 clinically significant cancer was diagnosed. As a urologist in the past, before I had OnQ Prostate, I found it very challenging to look at these MRIs, and I'm sure even most radiologists admit that many prostate MRIs can be challenging to evaluate. But now with OnQ Prostate MRI, I am really able to interact with them and use it as a helpful tool as we counsel patients planning out the biopsy, but also for treatment. Here's a case where the radiologist called a PI-RADS 3 lesion, so essentially indeterminate on standard MRI. Many urologists only targeting PI-RADS 4 and 5 lesions. Then the OnQ Prostate images right alongside of it, and you can see a clear demarcation of the lesion in the anterior aspect of the gland here, showing up pretty clearly on the restricted signal map as well as the color fusion map. The targeted biopsy yielded Gleason 3+4 prostatic adenocarcinoma with all other cores negative. So really a good example of OnQ Prostate adding clarity to an otherwise indeterminate case on standard MRI. Again, potentially going undiagnosed by many urologists who would have just continued to observe this patient. For case 3, we've got the standard MRI and OnQ images where the OnQ Prostate clearly depicts the posterior lesion much better than the standard MRI. Targeted biopsy of the OnQ lesion yielded clinically significant 3+4 prostate cancer. And our last case where, again, OnQ Prostate, much more conspicuous than the standard MRI. Targeted biopsy came back with a high-risk Gleason 4+4=8 prostate cancer. So I was excited to be able to implement OnQ Prostate MRI into our practice, which utilizes restriction spectrum imaging, or RSI, which again adds color to the lesions, which helps increase accuracy and less inter-observer variability. In addition to enhancing detection on initial prostate MRI, I was able to seamlessly integrate it into our MRI targeted platform. Now, this is essentially a software add-on that can be added onto a center's current MRI system. They don't have to go out and buy a new MRI scanner with this technology. In addition to seamlessly integrating with MRI ultrasound fusion prostate biopsy platforms, OnQ has already made its presence known in aiding urologists with targeted focal therapy. Here, Dr. Cooperberg at UCSF was able to successfully utilize OnQ Prostate alongside the Focal One robotic HIFU platform. OnQ Prostate has also been looked at as a tool that can be utilized as a non-invasive radiological biomarker to predict prostate cancer progression or reclassification for men on active surveillance for prostate cancer. In this study, men on active surveillance were prospectively enrolled and underwent prostate multiparametric imaging and OnQ RSI imaging and reviewed for PI-RADS scored lesions, followed by an MRI imaging guided prostate biopsy. What they found was that OnQ RSI MRI provides a more sophisticated analysis and a more sensitive and specific imaging biomarker of aggressive prostate cancer. Radiation oncologists also struggle with accurately delineating visible prostate cancer tumors on conventional MRI. In this multi-institutional international perspective study, it was hypothesized that radiation oncologists would find accurately delineating prostate cancer tumors on conventional MRI challenging And using restriction spectrum imaging maps would improve radiation oncologists' accuracy for prostate cancer tumor delineation. And what they found was that RSI maps improved all contour accuracy metrics, improving radiation oncologists' ability to target MRI visible tumors for prostate tumor boost. OnQ Prostate was also confirmed to be a strong and consistent quantitative biomarker that performs better than conventional MRI for detecting clinically significant prostate cancer in a recent Journal of Urology publication. And in a European urology publication, OnQ Prostate RSI or MRI was again confirmed as a promising quantitative marker for clinically significant prostate cancer detection. Well, thank you again for your attention. To wrap up, I'm definitely excited about this technology. In my own practice, it is certainly helping more accurately detect clinically significant prostate cancer with the ability to better differentiate the areas with prostate cancer. I feel this will also translate into better targeted focal therapy in appropriate candidates, also help in planning whole gland treatment, but also in identifying men on active surveillance with progressing disease. Thanks again.